right, good morning, everybody. Thank you for joining us for this press briefing with regard to the state's response to the pandemic. We have a lot to cover today, so we're going to get moving. But as always, we want to remind people, please continue to practice all the great tools we've given you with regard to keeping that 6 foot of distance between you and other people when you're out in public. Wear a mask when you go to the store, wash your hands often. That actually kills the virus. Stay home when you're sick. That's an important tool to be able to slow the spread of the virus. So please stay home when you're sick. Also, just find those ways to be able to do the socially distancing and all that sort of stuff that will help us slow down. We know people are going to want to see their families at the holidays. So again, great opportunity to think about how you can structure a family get-together while still trying to slow down the spread of the virus, by wearing masks and spacing yourself out, and if it's nice enough to be outside, that kind of stuff. Make sure you get good ventilation in the room you're all getting together in. All those sort of things will help slow down the spread of the virus. That's going to be important. And of course, one of the other things you can do is go to Test Nebraska and get tested ahead of time. Again, it's not going to make you immune from getting it after you get tested, but it is one of the ways you can reduce the risk by knowing that at least at that point in time you were negative or positive. If you're positive, obviously stay home. I actually just went and got tested again on Sunday and got my test results back in less than 12 hours. So the Test Nebraska lab is really humming there to be able to turn around those test results. So again, please consider Test Nebraska. We've delivered over 545,000 test results since the beginning of the pandemic. And of course, this all is going to make sure that we're protecting our hospital capacity. See, we got the number up right here, 582 hospitalizations. That's actually below the 15% level. We've been below 15% now for 4 days. So if we continue on that trend, we will be going from yellow to blue. But again, please continue to practice the tools. Can't let our guard down. We need to continue to focus on slowing down the spread of the virus to protect our hospital capacity. So our hospital capacity today, 36% of our hospital beds are available, 41% of our ICU beds available. And Dr. Anton, I don't know when the last time we saw 41% of our ICU beds available. It's been a while on that one. And then 74% of our ventilators are available. And then, of course, again, avoid the 3 C's with regard to close contact, crowded places, confined spaces. It's a virus that spreads from one person to another. Avoiding that will help you slow down the virus. All right, so a lot to cover here today. First thing, we've got a number of speakers. The first one we're going to have is Dr. Kevin Richmuth, right? Richmuth, got it right? He is a pulmonary, pulmonologist at Nebraska Pulmonology Specialties, and a colonel in the Nebraska National Guard. So thank you very much for your service to our country and our state. Appreciate that. And he's going to talk a little bit about some of the frequently asked questions around vaccines. Obviously, we have now vaccinated over 8,700 Nebraskans, and we are rolling out more of those vaccines. And as we have rolled out the vaccines, we hear questions about it. So Dr. Richmuth is here to really address some of those questions that you might hear about the vaccine. That, again, if you think about it, these vaccines have been developed. They're both about 95% effective, which is just outstandingly remarkable. It really is a miracle of modern medicine to have these vaccines within the period of a year to be able to address this pandemic. So Dr. Richmuth is going to talk a little bit about some of these questions that have gone along with it. But just as a recap, Moderna got approved of, and so we expect to receive about 32,000 doses of the Moderna this week. We expect to have credited to us about 11,700 of the Pfizer. We're going to bank those and put them together with next week. So the week of December 28th, we will start our pharmacy program through Walgreens, CVS, and community pharmacies to start vaccinating our long-term care staff and residents. With the Moderna that goes out this week, some of those long-term care facilities may get the vaccine this week as well, because some of those facilities are not in the pharmacy program. So we're going to be addressing our folks in long-term care facilities as a part of that. So anyway, Dr. Richmuth, we're going to come up and talk to us a little bit about what you know about the vaccine and why it's safe and effective and why people should take it.
Well, thank you, Governor. I don't know if we can get my slides. Thank you. So first of all, before I start talking about vaccinations, I want to take the opportunity as a healthcare worker. We constantly hear the appreciation from everybody for what we do. and we don't always get to say that thank you back. These numbers decreasing that you've seen that the governor just commented on, that's no small accident. Those numbers decreasing are because of people listening when we were making those pleas back in early November to do the right things, make the right choices, follow the 3 C's, really think about what you were going to do. This virus doesn't take a knee, it doesn't take a break. As I've said in a letter to the editor I wrote and in another press conference, it likes soft targets. So it will take every opportunity to infect and transmit and continue to do that when people don't do the right things. With that said, regarding the vaccinations, if you've watched any of the news locally, nationally, you see an amazing amount of emotion amongst the healthcare workers regarding this vaccination. And the reason you're seeing that is because, as we all know, how long of trudge and how difficult this has been. And working in the ICU, being at the beginning of this as the state surgeon for the Army Nebraska National Guard, and all the work that our community, our government, the governor's team, DHHS, Nebraska Medical Center has done to prepare and put us in the right place, we finally see something that truly could end this pandemic and put us back into more normalcy. Now that said, like I've told a lot of people, this is hope and a light at the end of the tunnel, but we still have a long tunnel to go through. We have some very tenuous times coming up here in the next several months, and all of those things, up until this vaccination being widely available, are going to be critical. I would say, as a healthcare worker, having received my vaccination on the first day, on Monday of last week, no problems with it whatsoever, but my decision to be in the front of the line to receive that really was not about myself, frankly, or protecting myself. I felt fairly comfortable with the choices I was making and the protection I was having in the healthcare facilities where I work throughout Lincoln. The decision was made regarding being part of the ultimate solution of getting vaccinated to protect our entire community, and that's really what the motivation was, I think you see from a lot of healthcare workers. So just real quick, the 2 vaccinations that we now have available, as the governor talked about, are called messenger RNA. And a couple things on this slide that I'd like to point out that will help kind of go through these frequently asked questions, these myths, if you will, misinformation that is out there about the vaccinations. This is just an amazing technology, and I'll start off by saying this isn't new. This wasn't just discovered or brought up for COVID vaccine development. This has been of interest, as I'll explain, because of how effective and novel and how many advantages it has as it relates to vaccine development. So simply what you do is you take the code that codes for that spike protein that the coronavirus uses to infect our cells, and you put that in a lipid nanoparticle. That's what that circle with the little lines represent. It comes into the cell. Then it uses your own machinery to generate just that spike protein. So what you're doing is, like somebody said on Twitter I saw, it's like you're sending an email to your cells with how to defeat the virus. You're giving it that code, and then what it does is it translates that code into a protein, the spike protein. You're getting the shot in your arm, so a lot of times it's the muscle cells that start that process. Then that protein gets presented, your body sees that blueprint and begins to have an immune response, the antibodies, the T cells, so that you're prepared when that spike protein presents itself as the virus invading your body, you're ready to fight it. That immune response, not just the antibodies, but the T cells are ready to fight it and stop it. So one of the common things that comes up when you're talking about RNA and the coding, if you will, is does it alter our DNA? Does it alter our genetics? Absolutely not. That mRNA sits in the cytoplasm. It does not get into the nucleus where our DNA resides. So it can't do anything to our genes, to our DNA whatsoever. When it starts that machinery of making the spike protein for our body to make the immune response, then that mRNA is degraded. It's destroyed. And so it really is novel. I would say it is an amazing feat of medicine, of science, that we have this, like the governor said, within a year. You go back to the 1918 pandemic, it took them almost to the end of the pandemic to discover what was even causing the influenza pandemic. Lots of people thought it was a bacteria. So just imagine this. We not only identified the virus quickly, we got the coding for it and determined how to make a vaccine. Now that said, there's other vaccine platforms. China is widely using an inactivated virus right now, has vaccinated over 1 million people using that platform. That's what our flu shot is like. Russia has the Sputnik 5 that you hear about. That's an adenoviral vector, kind of the same principle, genetic coding, but that's what they are using. And so there's other platforms that are in the works as it relates to our U.S. vaccine response, but these are the first two that took the lead and got FDA approval. Go to the next slide, please. So there's no better image to show the efficacy, frankly, than this picture. The top one is the Moderna, the bottom one is Pfizer. What this is these are called Kaplan-Meier curves. Across the y-axis, you have cases. Across the x-axis, you have time. And so it's amazing how similar these two vaccinations are. So you get shot one, and within about a week of getting shot one, you see that separation in cases. So the blue line on the top, I think it's blue or green on the top graph, and then the red line, that's the group that did not get the vaccination. And you can see very quickly a separation after the first shot of cases accumulating in the placebo, the non-vaccinated group, compared to the group that got the vaccine. And that it becomes more robust over time. I mean, we look at Kaplan-Meier curves for all kinds of therapeutics. We never see Kaplan-Meier curves like this, with this kind of separation in a therapy or a prevention like this. So this proves the efficacy the governor was talking about, over 94% effective across the spectrum of age, race, gender, all of those kind of things within the trial. The other thing I point out, not on this slide, is that in the case in particular of Moderna, it prevented substantially severe disease. So 30 cases of severe disease in the placebo arm and 0 cases in the vaccination arm. So that's pretty substantial. One thing I will say that gets a lot of press in this reason, people say, I got vaccinated, now I don't need to wear a mask. These are symptomatic infections. So we're not as sure right now. There's some early data in the Moderna trial that seems to show it reduces asymptomatic spread, but that needs to be determined yet. So it prevents symptomatic disease. So in other words, if you've had the vaccination, you could still potentially shed it to somebody standing next to you who hasn't been vaccinated. That's why we need to continue these measures that have been talked about. Next slide. So just a couple myths, because we get asked about this a lot. And I can tell you this message I'm telling you, this is a consistent message with regards to medical personnel regarding our confidence in this vaccination. So first of all, I think I kind of covered the first three. I guess the second one, what I'll do is say the process cut corners. Not true, it followed all of the normal vaccination protocols. Here's the difference. Here's what happened differently that allowed this to come so quickly. Number one, for all the criticism you want to give about the government regarding testing, PPE, all those kind of things, early on they committed to a vaccination, threw resources at it, and allowed the process to happen in parallel. Normally what happens is it's sequential. You have a phase one, no company's going to get out ahead of itself. This showed the confidence that they were going to have some backing so they could do things in parallel to get through a phase 3 trial more quickly. And the meetings you heard about over the past 2 weeks by the FDA Advisory Committee and the CDC's ACIP Committee, those were emergency meetings. Those meetings don't happen that quickly. So everything to put in favor getting this vaccination out to the public as quickly as possible. The second thing I'll say, we're in the middle of a pandemic. What's the saying? The necessity is the mother of all invention. In this case, we have an extraordinary situation with a pandemic, lots of cases going on, so you can more quickly determine a Kaplan-Meier curve like you just saw because the virus is widely circulating. So you see a big difference in who got the vaccination and who didn't. So those are two reasons why this isn't cutting corners and why it was quickly developed. Infertility is something that often comes up. I'll just put that to rest right now. American College of Obstetrics and Gynecology, the Society of Maternal-Fetal Medicine, both have endorsed this vaccination for women whenever they fall in that phasing. So this does not cause infertility. Don't believe the social media myths out there that aren't evidence-based. Was developed from human tissue. That's not true either. This is a synthetic virus, and even I was very happy to see that the Catholic Bishops Committee put a statement out last week endorsing this vaccination to be taken for the love of neighbor and the moral commitment to our community. So that says in their assessment of this vaccination, these issues are not a problem in their mind. Bell's palsy. Here's what I'll say about Bell's palsy. You heard about this on the news. There was an imbalance between, in the Pfizer group, 4 people had Bell's palsy that got the vaccination, none that didn't. That's no different really though than the baseline amount of Bell's palsy you would expect in the Moderna vaccination, 3 in the vaccination group, 1 in the placebo. So that's going to continue to be monitored, but at this point, there's not enough evidence to say. Now, at this point in the U.S., these trials were 30,000 and 44,000 in the 2 studies. We've already had almost 600,000 people across the country vaccinated, just healthcare workers and so forth. So we will see if there's any signal that shows up. Thus far, there hasn't been any reports. I took my vaccination. Every day I get an alert from the CDC regarding answering questions if I'm having any symptoms, side effects. That's happening. 2/3 of the people that have been vaccinated have signed up for that. So we'll have some good post-surveillance data. That it includes a microchip or makes you a 5G antenna. There's no microchip in this vaccination. You will not be a 5G antenna, I promise. I put my word on it. The other thing I will point on here, not on the slide, that you're hearing a lot about in the news is the allergic reactions. So there have been some reports of anaphylaxis. Those did not occur in the trial, so 30,000, 44,000. But when you vaccinate more people, you obviously can find things that happen. The anaphylaxis does appear to be occurring at a rate more than what we see with, let's say, influenza vaccination, which is roughly 1.35 cases of anaphylaxis per 1 million people vaccinated. This does seem to be more. They're actively studying this and determining this. I will tell you your risk of anaphylaxis is much lower than your risk of getting COVID-19 or passing COVID-19 and having a bad outcome. So I still stand behind, even as we monitor this, that anaphylaxis is not a reason not to get it, and we have safety protocols in place. The bottom line is if you have a history of anaphylaxis to vaccines, you have to determine the benefits and risks in your own individual case. Next slide. So the bottom line, vaccines have been an amazing development in our public health. Many people would argue it's the most substantial advancement that occurred and saves the most lives. This is the '94 Husker defense, which we all remember. And the best offense against this virus is going to be a good immune defense, which the vaccine provides. Next slide. So as this vaccination to end our pandemic, we do need acceptance. You're seeing healthcare workers do it. As the governor talked about, we're going to get long-term care, those phasing that the CDC ACIP just announced yesterday, with the next group being 75 and older and mission essential workers. As this becomes more available in the coming months, we are going to need people to take it, because if we're going to reach herd immunity, by the calculations, we probably need, with a vaccine this effective, with what we're seeing with this virus, about 60 to 70% of the population to get vaccinated. So we really need this to reassure people that this vaccine is safe and effective, and this is how we're going to end the pandemic. We do not want to reach herd immunity by natural infections. We will have over 1 million deaths in this country, and not to mention untold amounts of morbidity and repeated hospital strains and capacity issues. So please, use a trusted source. You're going to hear people like me up here talking in press conferences and newspaper clippings. Trust somebody you trust as it relates to showing that this vaccine works. Ask your doctor. Ask somebody you know. But please don't choose not to get this vaccination simply because of something you see on Facebook or Twitter regarding microchipping, 5G, infertility, all these things that aren't evidence-based. So, thank you.
Thank you, Dr. Richmond. Appreciate that. Great summary of all the things about why people should accept the vaccine and get it when their turn comes up. So thank you very much. Appreciate it. And again, thank you for all you do as a healthcare worker and as a National Guardsman, too. We appreciate that. All right, so our next program is going to be around long-term care. As I mentioned, this is something that we've been talking a lot about. Long-term care facilities early on in the pandemic were something that we were putting a priority on to protect. Actually, it goes back 5 years now with the Infection Control Assessment and Promotion Program, the ICAP program, to help train long-term care workers about how they prevent infection just in general. That was 5 years ago. More specifically, with regard to the pandemic, and that is a partnership between the state and UNMC to be able to do that training. Shelley Sweeto has done a fantastic job of getting out there and doing on-site training, web-based training and everything. We also asked all the long-term care facilities to put together plans. We have prioritized testing for them. In fact, we've delivered tens of thousands of Abbott Buy Next Now cards to be able to test their staffs to help stop from virus getting into the residents. We are working on a monoclonal antibody program to be able to get this treatment to folks who are 65 or older who have those symptoms early on to either prevent them from going to the hospital or limit the severity of their symptoms. And then, obviously, we're making a priority to get them vaccinated by banking up our Pfizer from this week and next week, and I already talked about the Moderna and so forth, so getting them vaccinated. So there's a number of steps we've had to take. We know that part of it has been that families have not been able to visit their loved ones in these facilities to help reduce the risk of the virus getting in, and we know that's a hardship for the residents, a hardship for the families, and so that's just one area where we've asked to have patience. We do have Heath Pody from the Nebraska Healthcare Association here today. He's their executive director that's going to come and just talk a little bit more about long-term care facilities and why it's important that we continue to protect the folks there. So, Heath?
Thank you, Governor Ricketts. This is an exciting day. Not only was it really interesting to hear the data and some of the backstory with the vaccine this morning, it's exciting because for long-term care providers, today represents a little light at the end of the tunnel. I think back to the number of celebrations that we've asked your patience on as Nebraskans over the last number of months, especially through November and now into December. The celebrations that you've had to be without those elders, those seniors that reside in congregate living facilities like assisted living communities and nursing homes. But it's exciting because this vaccine, as you just heard, represents our way out. I completely appreciate Governor Ricketts' prioritization of long-term care team members, of long-term care residents. We know the vulnerability of this population. Dr. Antone has spent a tremendous amount of time with his team on working with us to make sure that we have what we need from a PPE perspective, from a testing perspective that Governor Ricketts just talked about, and now as we're prioritized for the vaccine. It's indeed a big day, but I have to ask for your patience just a little bit longer. I understand I don't have currently a loved one in a long-term care facility, but I have in the past, and I understand as a lifelong operator of long-term care and also from a family perspective what those connections mean. I get it, but I have to ask for your patience just a little bit longer. The lesson that we learned in this, especially from the long-term care perspective, is that what we do as the community around those facilities that we care so much about, specifically our willingness to wear a mask, our willingness to socially distance, our willingness to stay away from large group gatherings, that behavior completely affects the ability of that retirement community, that long-term care community that we care so much about to keep the virus out. You just heard compelling discussion that this is good, we're moving forward, but we have to continue to use the right precautions for just a little bit longer. So Governor Ricketts, I appreciate the opportunity today to emphasize again, to ask for Nebraskans' patience, to ask for their behavior so that we all continue to do the right thing, whether we talk about it from this 3 C's perspective, whether you look at it from a wearing your mask perspective. We need you just a little bit longer, and there will be better days ahead. We will be able to connect with our families again. I just want to leave with this. There are so many people that we should thank. We talked a little bit about that earlier, from the healthcare workers, of course, from the families for their patience, from the residents for what they've gone through, the idea that they've not been around their loved ones and being able to touch them. From the pharmacy perspective, the number of teams that are going to be working and have been working around the clock to administer this vaccine in Nebraska. And then, of course, those team members in healthcare facilities, which have my admiration and my appreciation. It's a debt I don't know how we'll repay, but thank you so much. Governor Ricketts, thank you again for allowing me here today, and just ask for that patience just a little bit longer.
Thank you very much, Heath. All right. Now, prior to the pandemic, one of the things that we really talked about a lot was the administration's growth here, or strategy to grow Nebraska. All the things we're doing to try and grow our state, create more and better job opportunities for our people, and so forth. As we see that light at the end of the tunnel that Heath was talking about, the vaccine becoming more widely distributed, us being able to work our way through this pandemic, we need to be thinking about how we're setting our state up for that future growth. And one of the things that we also need to remember is that that growth needs to include everybody. On Friday, we found out that Nebraska, again, has the lowest unemployment rate, 3.1%. I think we're tied with Vermont on that. We've got the highest workforce participation rate in the country. We want to continue to see that type of development, but it's got to apply to everybody. It's got to apply to folks who are urban and rural. It's got to apply to folks in agricultural technology. It's got to apply to folks who are white, black, Latino, Native American. Everybody's got to participate in this. So one of the things that we have done is work to be able to help grow the North Omaha community. We have established a new DMV there in North Omaha, a new Health and Human Services office. We've, early on in this pandemic, reached out to the communities both in North and South Omaha and engaged them about how we slow the spread of the pandemic here. And one of the things that we're going to be talking about today is a new office for the Department of Economic Development on how we can, again, help further and encourage that growth in North Omaha. So with me here today is Tony Goins, who's Director for the Department of Economic Development, and Tony's going to talk a little bit more about that. Tony, can you come up and inform us about this new office?
Yes, indeed. Absolutely, Your Honor. So, Governor Ricketts, thank you very much. As the governor stated, I'm here today on behalf of the Department of Economic Development to announce our latest mission-critical initiative, and that is the launch of the new Omaha field office. Thanks to the leadership of Governor Ricketts, DED will have, for the first time in his 50 years of service, a physical location in North Omaha, which will be dedicated to spurring business and economic development opportunities throughout the entire region. That is an initiative designed by our governor in an effort to directly address economic needs and opportunities in this community, such as employment, workforce development, entrepreneurship, and business expansion. The facility is a part of a larger deployed effort by our governor this year, the North Omaha Economic Revitalization Committee, and that is intended to break barriers and create new opportunities for the business throughout the region. That committee is being led by myself, Danette Smith, who is the CEO of the Department of Health and Human Services, Jason Jackson, my friend who runs the Department of Administrative Services, and others from the North Omaha community. We're thankful to have access to this office space. We'll share it with DHSS. I would like to thank CEO Smith personally for her ongoing support and leadership, which has been critical in making this project a reality. This facility will kick off with one full-time staff member right now, who I'm going to name shortly, whose job will be to serve as a beacon and an ambassador for leadership and progress in North Omaha. This person will be supported by DED personnel and eventually a dedicated housing specialist, and among other possibilities that will support that person in that office. The field office will help our department further execute the governor's vision to grow Nebraska through efforts such as attracting businesses and job creators, providing support for entrepreneurship and local business expansion, developing the workforce, growing the housing inventory, which is really critical, and vibrant placemaking. These activities require passion for the community and the ability not only to lead, but to serve. The new head of the North Omaha field office, Trayvon Brooks, possesses these qualities and will be an incredible asset to our mission and to the citizens in the state and the Omaha community. Trayvon is a 6-year veteran of the United States Air Force out of Offutt. He's a Bellevue and Midland University graduate, a Greater Omaha resident, an entrepreneur, and a very experienced mentor. His leadership skills, strategic thinking, and ability to empower others exemplify the ambassadorship and the proactive spirit that will make our efforts in this community a success. Mr. Brooks will be supported by attorney Jacqueline Morrison. She's a Georgetown University law grad who we hired earlier this year to help administer Nebraska's business incentives. She's an outstanding and respected talent who will contribute greatly to the success of our mission. Our department looks forward to working side by side and in collaboration with our various partners throughout Omaha, which includes local business owners, the City of Omaha, the Omaha Chamber, the university, our community colleges, and other entities that will support this effort to spearhead and achieve mutual goals on behalf of the community. Before I close, I'd like to again thank Director Jason Jackson and our partners from the Department of Administrative Services for their contributions to this effort. The community outreach plan by DAS will be vital in helping inform and connect North Omaha small businesses to numerous contracting opportunities available throughout the state of Nebraska. Such opportunities can be and serve as a launch pad for further growth. As a small business owner myself, I thoroughly understand that first solid opportunity will be critical in instilling confidence for the future. That's really the heart and soul of this initiative, creating opportunities to just do business and fostering a more successful, economically vibrant community. In conclusion, we are excited and enthusiastic for this new development. We look forward to serving and working alongside the citizens and the leaders of North Omaha to grow Nebraska while expanding our horizons for its people and families. And like I always end, Governor, we all wear the same jersey. That's right, we all wear the same jersey. Thank you.
Thank you very much, Tony. You're right. We all are on the same team. We all wear the same jersey. Appreciate it. Now, Tony was talking about also how we need to break down barriers and obstacles. And that's one of the things that we've also done in the administration. Taking a look, for example, at our what we're doing for hiring practices. And let me take a step back here for a second. The state of Nebraska is a preferred employer. It's highly competitive to get a job with the state of Nebraska. We hire about 5% of the folks who apply for our positions. And we have just so many wonderful things to offer as far as career opportunities and so forth here at the state of Nebraska. So one of the things that we have done is looked at how are we making those opportunities available. And so with the leadership of Jason Jackson, our Department of Administrative Services, we've looked at some of our hiring practices and changed things up. So for example, if you are qualified, it's automatic that you get moved on to the next level of interviews and so forth. So there's no human intervention. If you meet the job description, you automatically get moved on. We look at advertising in places where minorities are, publications of minorities are consuming. And we also hire a lot of veterans too. So with these different types of programs, looking at how we're doing, we've actually seen that minorities are taking jobs with the state of Nebraska at an increasing rate. In fact, back in 2014, about 7.3% of our teammates were minorities. And in 2019, that number had risen to 11.3%. It's over a 55% increase, and it increased every year. So we saw minorities increasingly taking jobs with the state of Nebraska, which is fantastic. And of course, obviously we just had Tony here, who's our Director of Economic Development, but you can think about Danette Smith, who is our CEO of Health and Human Services. Now, think about that. We have a black woman in charge of our largest agency that is responsible for over 4,600 of our teammates and over a couple $2 billion in budget. And she's not the first person in my administration, right? She's the second black woman to run that. There's only been one black woman CEO in a Fortune 500 company. So we want to make sure we're taking down those barriers. And when we see that minorities are taking those jobs, which is really fantastic. So as we think about how to take down barriers, Jason Jackson here is to talk about another way we're doing that is through contracting with the state. As we've engaged with different communities and heard about some of the obstacles, Jason is putting plans in place so that we can engage with those communities to, as Tony said, just do business. So Jason, will you come up here and talk about what we're doing to be able to engage more minority businesses and really take down some of those obstacles so they can do business with the state?
Yes, sir.
Thank you, Governor Ricketts, for the opportunity and for your leadership. My name is Jason Jackson. I'm the Director of Administrative Services and Chief HR Officer to the Governor. Administrative Services oversees both our state personnel operations as well as our state procurement operations. The Governor talked about some of our successes in terms of workforce participation among our teammates with minorities. And Governor, in fact, I'd go so far as to add that we actually have the highest workforce participation among minorities for any year on record going back to 1992. So we really appreciate the inclusivity that we've been able to build among our team. And the Governor's direction this year was, how do we replicate that success in other aspects of our business? And that's where the call to action was to look at our state procurement operations and see if there's opportunities to grow Nebraska, create opportunity for small business and minority-owned business. And what we've done is we've identified opportunities that we believe drive ease, transparency, and greater awareness so that minority-owned business and small business can have a greater degree of, or greater opportunity for success in winning the business of the state. This is a huge opportunity. Every year, we enter into about 600 contracts. In any given year, we have approximately $7 billion total dollars invested in entities that we're doing business with as a state. So this is a big opportunity to invest in our community and grow Nebraska. So the steps we're taking: first, driving ease into our process by initiating a vendor concierge program. We're going to dedicate a procurement professional to any firm that wants it to walk them end to end through our RFP process. Our hypothesis is that this will demystify the process, and small firms, minority-owned firms that might not otherwise have pursued opportunities with the state because of perceived complexity, if we can lower those barriers and create opportunities by walking vendors through that process from end to end, giving them the coaching they need to make their bids competitive, we're going to create more opportunity for small business and minority-owned business. So that's the first step. Second, transparency. Historically, firms wouldn't learn about an opportunity to do business with the state until we actually post an RFP. Our hypothesis is that biases the process towards larger firms that are more sophisticated and have more administrative support and can quickly pivot to put their company in a position to be successful. But again, we want to capture more small business, more minority business, and businesses that might not have that opportunity without some opportunity to anticipate and make their bid competitive. So to that end, if you go to our website, das.nebraska.gov, effective today, you will see a list of every service that a company can bid upon. And not only that, but a prospective list months out of the services the state anticipates having to contract for. That'll allow firms to look ahead and say, hey, if I want to try to win the business of the state, I can begin positioning my firm now. I can leverage that vendor concierge program and put forward the most competitive bid I can to put my firm in the best position to be successful. And then third, awareness. We're going to begin, again, replicating some of the successes that we've had from a workforce participation perspective. We're going to begin advertising in media that's consumed by minorities and minority firm owners. Our hypothesis is that through greater awareness, we'll be able to drive more bids into state government and award more bids to Nebraska businesses, minority businesses, and small businesses. Then there's a fourth initiative that we're also excited about, and that's collaborative contracting. A collaborative contract, it allows government entities to basically avoid an RFP process by pursuing a contract that another governmental entity is entered into. What we're going to do is we're going to coach Nebraska businesses and Nebraska firms, including minority firms, in terms of how to participate in cooperative contracts in other jurisdictions. So our Nebraska businesses can be competitive nationally with other states and jurisdictions through those types of agreements. In totality, we're optimistic that this is a win-win. It's a win for these businesses and gives us a great opportunity to grow Nebraska by investing in Nebraska business, minority-owned business, and small business. But it's also a win for the taxpayer, because the more bids that we can get on our services, the more competitive the marketplace, the more value we can pass on to the taxpayer through awarding those bids to the most competitive recipient. So, Governor, thank you again for your leadership and driving this initiative forward.
Great, thank you very much, Jason. Appreciate all the work that your team has done, and Tony, your team has done great work, both groups. Let's see, so again, before we get into questions here, with regard to the upcoming schedule, we're going to take a break over the holidays. Our next scheduled press conference will be on January 4th. We'll pick it back up again then after the new year. Do have a couple of questions here that were submitted ahead of time. One by Andrew Ozaki. Apparently, Andrew, you didn't think you might make it in today, so glad you're here. In Phase 1A, they specify that people on subgroups need to be dealing with patients in order to be vaccinated. In other words, office staff are not eligible. In my opinion, I think this is from one of your viewers, is that right? Yeah, okay, great. in my opinion, a similar set of criteria should be established. Take the category food, agricultural, are all restaurant workers included? Are all farmers and ranchers equally covered regardless of interaction with others? How about corporate seed salesmen? So the point here is that we are going to be making priorities within those groups in Phase 1B as well. In one of my previous press briefings, I'd use the example of a trucking company, that we're going to be prioritizing the truck drivers and the mechanics, those skilled positions, and again, not the office staff people. So the same sort of approach that we've taken for healthcare, where we really prioritize those frontline people, we'll be doing the same thing with regard to those other groups in Phase 1B. And from Matt Oldberding, the Lincoln Journal-Star, on Friday, the governor talked about banking 11,000, actually it's supposed to be 11,700 Pfizer doses for vaccines at long-term care facilities. Are those doses that CVS and Walgreens will use as part of their vaccination programs, or are those doses for a different program? Those are, so we're going to bank the doses, the 11,700 for Pfizer from this week and next week. That will allow us to start our pharmacy program. So those will all go to the pharmacy program for CVS and Walgreens. So just to be clear, we will not actually physically be taking delivery of those Pfizer vaccines this week. We'll be banking them. The federal government will hold on to them, and then they will distribute it directly to CVS and Walgreens and the community pharmacies to be able to start that long-term care vaccine program the week of December 28th. So that's how that will all work. We had a requirement from the federal government that you have to have at least half the amount of vaccines available to go. They actually just recently loosened that up to you could do it with 25%. So we are going to be able to get that going next week, is just the logistics allow for that. Taylor, did you have other questions that were sent in?
We have one from Doug Walton. He asks, does the new federal economic stimulus package meet Nebraska's needs?
So Don Walton's asking, does the new federal stimulus package meet Nebraska's needs? I have not had a chance to get fully briefed on it. I believe they only kind of came to agreement on it yesterday, but I believe it includes things such as the PPP program, which has been very beneficial to Nebraska. Over 40,000 organizations in Nebraska have participated, $3.4 billion. And that's a great tribute to not only our small businesses that have worked hard to be able to take advantage of that, but also our community bankers who worked hard, got up early, stayed up late to be able to access that website. My understanding is there's also going to be additional money for states to do testing and contact tracing and so forth. So that's going to be beneficial as well. But we'll need to break down the entire package here as they get it finalized and actually vote on it and approve it, because, as you know, until they actually get the president's signature, you just don't know what's going to happen with that bill. Anything else?
That's all for now.
All right. So questions from the audience here. Martha.
My question, I believe, is for the doctor. We've all heard about the reluctance of a number of people to get the vaccination, and you're trying to address that. Do you think that you're starting to make some changes in attitudes? I mean, I've heard friend of a friend, of course, but of a COVID nurse who didn't want to take the vaccination because she wanted to start a family in a couple of years.
So Martha's asking, with the education we're doing, such as having Dr. Richmond here to talk about the vaccine, are we making progress in changing people's perspective with regard to taking a vaccine? I'm going to let Dr. Richmond actually answer it, but I will tell you, Martha, at least from what I've seen on national polling, is that the percentage of people saying they're willing to take the vaccine is going up. So I think as we get more into this process and more information comes available, obviously we just got the information from Moderna from the FDA last week, the week before that from Pfizer. So as we see more of this information come out, I think people will get more comfortable, but it does require us to do this type of education. So Dr. Richmond, I'm going to ask you to come up and do a little more educating.
Well, thank you, sir, and thank you for that question. Yes, I agree with the governor. If you look at some of, I'll say anecdotally myself, but then also some of the polling that's been done, we are seeing an increase in people that survey or poll that they'd be willing to take it. And I think, like the governor said, this is still early on, and like I said, we've had over, I think now 600,000 people, mostly healthcare workers, vaccinated. And so there's going to be another period of time where I hope people get comfortable with this and willing to take it. The saying in public health goes, vaccines don't save lives, vaccinations do. So we have to get people vaccinated, and part of that's going to be educating, reassuring, and re-educating and re-reassuring as this goes.
Thank you, Doctor. Andrew?
Yes, how concerned are you about St. Francis Ministries? And how are you monitoring their financial stability?
So the question was with regard to St. Francis, who's currently administering our Eastern Service Area Agreement for Children and Family Services, and their financial state. It is obviously something that we are having ongoing conversations with them. I've spoken with William Clark, who is their CEO. He assured me they're stabilizing their organization financially, and we're going to continue to work with them on that. We interviewed them a number of times with regard to their financials, and that's part of the overall process. And in fact, actually the entire process that is governed on our whole procurement, as Jason Jackson is here to attest to, is really driven by statutes. There's laws that we have to follow with regard to this, and it does include getting financial information. So we received a lot of financial information from them. We're going to continue to get that financial information and follow up with them. And, obviously, we expect that we're going to continue to work with the Health and Human Services Committee on this as we go forward.
And how comfortable are you about sending, I guess we're sending $27 million in CARES Act funding to them? I mean, have we already sent the money to them? And are we sending good money to possibly a facility that may go bankrupt?
So Andrew's asking about $27 million in CARES Act funding, and I'm not for certain what exactly you're referencing there. I'm going to look to the help here. I don't think we have anybody from HHS. Dr. Anton, you don't have, we'll have to get back to you on that one, Andrew, because I'm not
I guess the
familiar.
general question is, should we be sending money to them right now when there's questions about their financial stability?
So the question is, though, should we be sending money to St. Francis when there's questions about their financial stability? And certainly, anything we do with regard to their St. Francis contract will be done where we're going to continue to monitor to make sure they can provide the services they've promised to provide for us. So we will continue to make sure we're working with them so that if we're providing additional resources to them to be able to take care of our children and families here in the state, that we're doing it in a way that makes sure they're sustainable going forward.
And do you have a plan B in case they do, file for bankruptcy?
And so the question is, do we have a plan B? And it actually isn't so much if they file for bankruptcy. Bankruptcy allows organizations to continue to operate with protection from their creditors. But I think what you're more talking about, Andrew, is what if they go out of business entirely and can't continue to provide services? Is that really more what you're looking for? Right. So the question is, what happens if they can't provide those services? And of course, we're having those discussions within the Department of Health and Human Services about how we would handle that contingency as well.
Senator Howard has said that they're not meeting the terms of their contract. I believe she's referring to the caseworkers per kids ratio, and has asked how long we'll put up with that.
So Fred Knapp from NET is asking, Senator Howard has said that St. Francis is not meeting the requirements with regard to their caseworkers, the number of cases per worker ratio, and how long will that continue to go on? And that is actually part of the conversations we're having with them about making sure that they get up to meeting those staffing needs, that with regard to having the appropriate number of caseworkers to be able to handle the cases and not overburden the caseworkers. So absolutely, we're driving toward that.
They had previously said, well, we can do that if you give us another 15 million, and you said no. Is additional money part of the conversation?
So Fred's asking, is additional money part of the conversation? And certainly, we're going to have a dialogue with them about what sort of resources they need to be able to continue to serve our families. But again, it'll all come with, expectations about how they're going to continue to do that and their financial stability. So those are ongoing conversations, but our plan right now is to continue to make sure we're looking out for the children and families first, which means around stability in getting them the services they need, which the only way you're going to provide that stability is through St. Francis. So we're working with St. Francis to be able to continue to take care of our kids. Andrew.
You have one provider, Omni, that said that they're behind, that St. Francis is behind in payments to them. I mean, how concerned are you about, them making payments to Nebraska providers?
So there was a question around whether or not Omni said they were behind in their payments from St. Francis. And obviously, again, we're going to continue to work with St. Francis to be able to make sure that they're taking care of our kids. We're providing the resources necessary. That means they need to pay their vendors as well. So I'm not familiar specifically with Omni's complaint here, But we certainly want to, again, make sure we've got a stable organization to be able to take care of our kids, whether it's going to be personnel or financial or what have you. Martha?
I'm interested in what the state did to assure that they were financially stable, and given what's come out since, what went wrong in that process?
So Martha's asking, what did the state do to be able to look at their finances originally, and what went wrong in that process that we weren't aware of this? Well, first of all, we received audited financial statements in December of 2018. We also had them come to Nebraska and make a financial presentation. I think that was in May of 2019. And then we did an on-site visit down at St. Francis location as well, where we, again, finances were part of those conversations. So we received those audited financials. We did follow-up. We continued to ask questions. And with regard to some of the issues that are coming up with regard to this management, I would say that, if you look at, for example, Enron and what happened there, when you have cases where people are misbehaving and, I don't know to what extent they were trying to hide those or what the oversight was, but at least from some of the articles that they weren't following their own policies with regard to some of these expenditures. Those things do come to light, but sometimes it takes time for that to happen. And obviously, we're going to be, they've got new leadership there now. Their CEO has assured me that they're going to be financially stable, but we're going to continue to, dig into their finances and ask them to provide that information so that we can know that they're going to be financially stable going forward. Andrew.
Just a clarification, is Nebraska sending any additional money to St. Francis at this particular time?
So the question is, are we sending any additional money to St. Francis this time? And that's part of the negotiations we're going through right now to make sure we're being continuing, that St. Francis can continue to take care of our kids. So that's part of the conversations that are going on right now. And it's not just about money, it's about the whole broad range of services. Yeah.
Is there a reason why Nebraska wants to continue with privatization, given all the troubles that we've had with it, versus having state employees do the job which has been successful in the rest of the state?
So Martha's asked the question is, again, why this continued dedication to having this contract outsourced where we have other parts of the state that are handled by our state teammates, and why not just transition over entirely? So a couple points, Martha. Go back in time to why the state made this decision originally. It was because I think in 1 year there were 13 children in the state's care that died. And at that time, the legislature said that we've got to make a change. Part of that change was going to bring in additional providers to take care of the state, ultimately ended up with just the Eastern Service Region. So there was reasons why that this change was made originally. And then with regard to why are we committed going forward, because that's going to be in the best interest of our children to keep a stable relationship there with St. Francis, if that is at all going to be possible, so that those kids and families can continue to get care. Andrew.
Is $600 per individual enough, do you think, in stimulus?
So the question is $600 enough in the stimulus package per individual? I think one of the things we ought to just keep in mind is this stimulus package is the one that are passing now. I would imagine this spring that the Congress and the new Biden administration will take up another package. So this is really more of a bridge type program to get into the Biden administration and what sort of plans they have with regard to how they want to manage the pandemic. So I think it's probably just a step in the process of making sure the country, manages and works its way through this pandemic.
I had some questions about corrections. It seems like there's additional staff that are coming down with the viruses. Is there anything more? Can they be stepped up quicker to get vaccinations? And we're hearing some complaints from inmates that they're not getting the proper treatment in prisons.
So the question about corrections, again, just staffing and so forth, can they be moved up in the line? So again, we've got our priorities laid out there with regard to this, both the corrections personnel, as well as, which are in Phase 1B, as well as the inmates, which are in Phase 1C. And with regard to inmates getting the proper care, we obviously work very hard to be able to deliver the proper care, make corrections if we find that there's steps in our process that need to be improved. And frankly, just go look at the ACLU lawsuit, right? They just sued us on not providing proper health care to inmates, and they lost badly in court. The judge found that there wasn't any basis for them to have a class action lawsuit on that. So we worked very hard to provide high quality of care, and if an inmate has a problem with the level of care, they really should be bringing that up to management to let us know what their expectations are. We do try to provide that great level of care.
We have time for a final question.
All right, one more question. Yeah, Andrew, go ahead.
Can we ask Jason a question?
Jason, you can absolutely ask Jason a question. Jason, you want to come up, please?
It's about, maybe you might know too, it's about the investigation into the Russian, hacking, or the hacking of some of our computer systems. Has Nebraska been affected? Are you concerned at all that Nebraska's been affected by this at all?
I'm not in a position to say firsthand whether, so the question was, with respect to foreign actor hacking of our state's computer systems, are we concerned? I would say Ed Toner in our OCIO office is very proactive in terms of being on the leading edge of any defensive, deployments that we can make to try to make our systems as survivable as possible or as resistant as those types of things as we possibly can. And so we take those steps and we monitor those things very closely and respond immediately and proactively to make sure that our systems are in as favorable a footing as possible to those foreign threats.
But have you detected any type of intrusion into our system?
I'm not in a position to say.
Jason, so Ed says that they found no evidence of this to date.
Okay. So the response from Ed Toner, our OCIO, is that they've found no evidence of any foreign attacks on our systems to date.
All right, folks, thank you all again very much for being here. Again, reminder, next one will be January 4th. In the meantime, I hope everybody has a wonderful holiday season. Please, as you're going about to your family get-togethers, be thoughtful about exposing especially older members of your family to coronavirus, so please take proper precautions. And as always, again, we're going to remind you, keep that 6 foot of distance between yourself and other people in public. Make sure that you've got that mask on, that you're washing your hands often, stay home when you're sick. All these things will help us make sure that we slow the spread of coronavirus. Thank you all very much again, and have a Merry Christmas.